And so what we're going to be doing is primarily I'll be working with Jason. I might need people to just stay here if we go to turn him so that, you know, we make sure he's handled properly. Both parents will be in the room. Start with him supine, and we'll begin some of our assessment of his movement initially. Feel free to ask any questions or make suggestions, anything you want. We'll be open to this, but what we're going for here is increasing and healing that peripheral nervous system so it'll impact the neuraxis, and vice versa, impacting the neuraxis so it'll heal the peripheral nervous system. We can do that with lasers. We can regenerate nerves with lasers. And Jason is an example of that happening, because what you're going to see today has happened in terms of movement in the past month. Alright, we got a little bit and a little bit and a little bit, but the gains that he has made since we have started using the Q1000 have been momentous. Alright, he's actually been to the point where he's been able to lift his paralyzed leg 10 times for me without any assistance and without any recruiting of other muscles. And we'll see the kind of a situation that he is. Now, does he hold it? He backslides a little bit. But every time we work with him, it's cumulative. It's more, it's easier, and it's better. And the cognitive affect changes with that. The awareness, the level of awareness, the level of engagement in the world changes with that for Jason, okay? You'll see his traumatic brain injury was pretty global. A good portion of the right side of his head was involved, so the frontal lobe was involved, parietal lobe was involved, temporal lobe was involved. He has the shot that's visible, and I have done regular traditional cranial work for years with him, okay? I did traditional chiropractic for years with him. I did the traditional manipulation that you do with a stroke paralyzed patient. You move those muscles. The pain was phenomenal. And he let us know that, and we still had to try to do it, and it was exhausting. This has a very dedicated family. They had developed their own program for paralysis. They had never given up on Jason, and I told them, as long as you don't give up, I'm not going to give up. I'll be right there with you. We'll fight the good fight. I'll find and do whatever I can for Jason. He wants to work at Walmart again. That's been to talk about him. I want to work at Walmart. I want my job back. It was a motor vehicle accident, and this is 10 years since with the injury. So with that in mind, I think the transfer will be easier if we move everybody out of here and we just bring Jason, and then we'll bring people back in.
You know what I mean by tender?
We have some wonderful doctors with us today, so I'm really glad that you're able to bring Jason here.
It's okay if we stay?
Yeah, I want you to certainly stay because it'll keep the room warmer. We have no heat today, thanks, Jim.
Sure.
Okay, let me introduce you to, this is Jason Smith, this is Arlene, his mom, and this is his dad.
How you doing?
Good. Hello, everybody.
Did you want to give us a history on Jason?
I can.
Okay.
March 1st, '94, Jason was involved in a head-on collision. His car hydroplaned in a rainstorm. 3 o'clock in the afternoon, he was on his way to work. There were no drugs, alcohol, nothing involved. It was just a horrible accident. Jason was in a coma for 3 months. They told us that he would be a vegetable. There was nothing. There would be nothing. We should just put him in a home and forget him.
Traumatic brain injury.
He's traumatic brain injured. He had really no injuries to his body. There were no broken bones, except for some broken glass that cut the skin here. He was on a trach. He was had a
stomach peg.
And when we get him up in a wheelchair, he was absolutely flaccid. We had to tie him up, tie his head up to hold it back up. And then the tone and spasticity began to set in, and he just tightened up completely. They thought that, well, it was debatable which side he was going to have left. Jason was left-handed, and as you can see, his left hand is still involved. He did regain the use of his right hand, but doesn't have the dexterity in his right hand. We have a pump for baclofen pump, which is supposed to take down the spasticity. We're doing that through Shepherd Hospital. What else? What did I forget?
Well, you can tell them about the things you do at home. Because you work very
Okay.
hard with Jason every day.
Yes, we do. Every day, every morning for 2 hours, we have
Weekday
weekday mornings, we have volunteers that come in, and either Jim or I work with a volunteer. They're from our church, and they are not therapists. And we do range of motion, exercise, Jay. We do that, repeat that again with a different volunteer every night. Some of our volunteers have been coming almost 10 years, ever since we got Jason out. I should say the only broken bones he sustained, and not from the accident, he was in therapy, in-house therapy, and he had a shot of Botox in the left arm, shoulder, in here, to release this left hand. And his regular therapist went on vacation. They had a substitute therapist. She was very aggressive, and she dislocated his shoulder, left shoulder, down and under. And it took 10 of us in the emergency room to pull it back. The doctor, and they had to put Jason out to pull it back under. Shortly after that, they left him sitting on a table. And he did have some ability to sit, but not really by himself. He fell off and suffered a spiral fracture of the tibia of the right leg. That was his good leg, so that kind of destroyed just about all of our chances of getting a whole lot of walking. Heather came into our lives with as someone who believed that there would be more in Jason that we could do. Jason could not even speak. He had to learn all his words over again. He had to learn that this was a hand and I was a mom and that was a dad. But he's doing quite well now. We have short-term and long-term memory problems. But he does have a sense of humor. Sometimes it's very subtle. But I can't think of anything else. It's kind of Jason in a nutshell. We're still struggling with him. We finally, after 10 years, took us 7 years to get Jason to be continent. Took us almost 10 years to get AFOs. These are the braces for Jason's feet, because the tone was so severe that everyone we went to said, "I'm sorry, there's nothing we can do, just forget it. There's no way we can get his legs.
Just break out of them.
He'll just break out of them." And we had seen Jason break out of a plaster cast with the tone, just crack it.
Serial casting.
So that was not a good option there either. Anyway, Heather?
Okay, thank you so much for sharing that. Jason, how you doing today?
Well, speak up, honey.
You're cold? Well, you know what, this room is cold, but Jason has recently discovered cold. And I discussed that, by the way, with his PT. And what we both realized is that the changes that we've made with the laser are probably making an impact on him. So he's beginning to have different sensations. So he's experiencing the word cold. Now the other thing is that he switches words, so he could mean cold for other things. Remember?
Oh, do I ever?
Uh-huh. But that movement would, oh, you can't imagine how painful.
We used to try and get any movement we get, and we tell Jason we were counting underarm hairs because the movement was so slight.
Right.
So that.
And this is where we're starting today. Okay. That's where we're starting today. Now it's a lot of effort to get that moved, and there's a lot of resistance there. Jason, can you open your hand for me? Not that hand, this
With
hand.
your brain. Think it.
Can you open your hand? You're moving your fingers real good. Can you open your hand for me? Jason was in a complete claw hand when we started working together. And it was like this.
Thumb in.
Thumb in, I'm sorry.
Yeah,
Like
I was
this.
always in.
Okay, we couldn't get the thumb out. We couldn't get
Don't do
this
that.
joint open, so we had a lot of fungus and stuff to have to deal with, and it was chronically breaking down. Okay, so that's just what we were dealing with this. Cranially, you'll see with the muscle tone, he goes off to the left, and when he's sitting, he goes off to the left, and he's just recently gotten a wonderful new chair, so that kind of helps him to stay upright. But he also used to have profound scissoring of the legs, and you'll see that in the literature, the discussion of scissoring in the legs. And it'll probably show up when we start working, and we'll take these off, but even with these on, these legs would be crossed, and oh boy, I'm telling you, that was tough, hard work. Do you remember those days?
You want those off now?
Yeah, let's go ahead and we'll take those off. Okay, now you're going to see some perseveration with words and with gestures, and Mom's going to do some self-correcting of him, and that's fine. We're not going to interfere with that. So if you want, just we'll do this as a regular session. Bring the head forward, and if anybody wants to
Velcro's
quickly
alive.
do palpation, you get a torque here. Very mild. And do you see how mild his rhythm is? And he has what would be expected with a cranial, with a traumatic brain injury. He's got a lot of movement like this. Okay, so there's a lot of fascia involvement, a lot of scar tissuing, all those kinds of things in the cranium. I'm not going to have you guys work with this up here, okay? So what we're going to do here is we're going to see if at the end of the session we have improvement in his affect. Okay, so maybe his speech will be easier. We're going to see if we can reduce the muscle tone. All right, and we're going to see where we go with this. And Jason, one more time, can you help us with showing us how you're doing with your legs today? Hold that for me here. Let me have you try lifting this leg. Can you lift your leg? Oh, Jason, that's wonderful. How high can you lift it?
No hands.
No hands. Don't recruit your hand. Can you take it any higher? Come on, Jay. You got it.
There it goes.
All right, Jason. That's wonderful. Any higher? That's good. Just relax. We're going to make that easier to do. I want you to know that progress has been since we've had access to the Q1000.
Oh, yeah.
Right? And Wendy was here. She can tell you that's true. Because we haven't. This has been a paralyzed leg. Up until that movement was phenomenal to see.
How many visits?
In terms of the change that we've made, I've been treating him for years.
I'm sorry, you want to sit there?
In terms of the number of visits and progress that we made since we've added the Q1000 to his therapy, what, 2 weeks? 3 weeks, has it been? 3 sessions.
Yeah.
3 sessions.
We only come once a week.
Yeah, 3 sessions, and he's moving the leg that much. And we got movement before, but okay, what we're going to do, Jason, is I'm just going to work with our light. What would you like to work with first, your arm or your legs?
We'd be all like that.
Can you say that louder? Your legs? Want to work with your legs? All right. Tell you what I'm going to do. I'm going to do something here to help with circulation to your brain, too. So we're starting with the stellate ganglion to improve regional cerebral blood flow, to make our job easier and more effective. And just relax and watch. Shut. How you feeling? Feeling okay? You're cold? I'm sorry you're cold. There you go. Can you open your hand for me? Put your head down while you do it, though, because I'm doing other work here. Can you open that? Are the fingers up? You're doing great, Jason. Try opening your fingers for a minute. That's good. Point with your pointer finger for me. That's good, but don't try so hard. Just focus on your arm. Thank you. Thank you. Okay, open your hand for me again. Alright, now guess what we need to move next? That's good, your thumb's moving. Nice job. How about this finger here? Oh, look. That was easy.
So much easier.
Okay, thank you. Now we're going to go right to... I'll tell you what, let's do it this way. That's good. That's nice. See, it's starting to open and fan the fingers. Try your hand again one more time. You haven't even completed a whole duty cycle on the Q1000. Can you open your hand one more time for me? Okay, you want to rest for a minute while I finish this? Oh, greater occipital nerve. What's he itching? We're going right to the greater occipital nerve. It's easy for me to say.
Yeah,
Not to worry.
work on you when you do it.
Thanks, guys. And this is a lymphatic, remember, to the deltoid. Now, what I'm going to do today that I have not done, okay, is I'm going to treat his spinal cord. We haven't done that for him yet with the Q1000, okay? Okay, good. Okay, we're going to just go right here. Or actually, let me go to either side of the joint. Let's do the infrared on his joints. You have that infrared probe? This is infrared, and it's just more specific, so I can do the acupuncture points and stuff. There we go. Oh, we have some response. Thank you. I'm not muscling this at all.
Nice wrist, Jason. Very nice.
I'm not muscling this at all. Let's find the median nerve here.
Head down.
Spasmed initially, see? Go into the thenar eminence here, guys. And Jason, you want to relax your hand and open your hand for me, dear? Alright, this is what infrared can do. We're going to switch. What did we say about these wavelengths?
It's a deeper, more penetrating wavelength.
Alright, but what did we say the difference is between red? When do you use red and when do you use infrared? They say use red with acute and infrared with chronic. Now this is the first time I've been able to really test this and isolate and see if there's a difference in wavelength affecting this, okay? So today you're watching it and look, my preference is the red wavelength. Do you see it? Look how fast it's going. That's my preference, and it was the 630 nanometer that I used initially that where we got the change. Hey, give me a second, Jason. Watch that he doesn't knock that off the table. Somebody just. All right. Okay. Here, let's have you open your hand. All right. You want me to make it as easy as possible for you to open your hand? Look how straight that wrist is. This is a claw hand. This is supposed to be somebody who has no changes. They dismissed him as, that's it, maximum medical improvement. He was never going to change. They gave up on him. We don't give
Am I in the
up.
light?
We never give
I'm
up.
sorry, you talking?
I'm talking to the camera.
Never give up, never
Am I in this?
surrender, right, Jason? Okay. Open your hand for me, dear. Nah. No cheating. Open your hand. Come on. That's nice. How about the other hand? The other part of your hand. Can you get your fingers?
No, you have to do it with your brain.
Yeah, do it with your brain, Jason. Come on, no cheating. Sigdal points, guys. Right, Doc? I know you do. You know your acupuncture. Sigdal points. Look,
Good God.
do you see? Okay. There, that's a nice straight hand. What do you think? How's it feel, Jason? Does it feel good? This joint's not responding. There it goes. And to come anterior to get the response. And look at, check it out. You see the laser right through it. So you know you're... There you go. That's nice. Remember we talked about the middle finger representing the Chinese hand acupuncture? Yeah, so let's try hitting that.
Did you do those nails while you were there?
Yeah, sure.
We know where his sense of humor came from.
Oh, you don't know.
You don't know the half of it. Thumb is very representative of the
Want
brain.
me to help him hold it up?
Yeah, we're gonna let him do it.
Hear what she said?
It's
Wants to
okay.
show the
No,
dirt.
that's all right, that's all right.
What?
Let's keep going here. We're gonna address this. All right, let's go to each of the joints on either side of the hand. Maybe a little change with that too. So you come up the sides of the fingers. And you can take a person with osteoarthritis and straighten those joints out. And a little bit later you'll see rheumatoid arthritis of the hand and some of the changes that we made with the ulnar deviation. Okay, Jason? That was pretty good. Is there anything more we should show him? Do you want to try bending your hand straight for me? No, not with that. Just relax your wrist as much as you can. That's very nice, thank you. Now there's a little muscling going on. Okay, that's what I primarily used on him. See if there's any difference with everybody combined, okay, Jason? What should we do today? You want to scratch the back of your head? With this arm. Can you do that? Look. Bring it around. Put your head down, dear. Look to your mama.
Jason, look at me. Jay.
What's mom doing? Oh my God. Scratch the back of your head, sweetheart. That's great.
Look at that, Jay.
That's wonderful.
All right, you need to hold my hand and relax.
Oh, you scratch yourself. Oh, we see the myoclonus? You see it?
Okay.
Put your head down.
All right, let's start with relaxing.
All right, now watch. You okay? You okay?
Take a deep breath.
See the myoclonus? I patted him. Do you see it?
Yep.
Yeah. Stay relaxed now. Let me show you something. We're going to do this again. Now watch. And change the tone. This was... uncross his leg for me. In doing therapy with Jason, thank you. In doing therapy with Jason, the myoclonus response was profound.
Mm-hmm.
And it's gotten much better.
Relax, Jason.
Because if you just accidentally lightly touched him, that would happen. And now I can... Look,
Still comes out, but
It's still, but it's
do you
much
see
better.
it? How it's changed just from before I did it? Thanks, Jason. You're so sweet to let us do this stuff with you. I appreciate you coming and helping us become better doctors, dear. Alright, so let's figure out what we can do here. Now, there's a limit to what we can do without addressing the spinal cord, and that's what you're seeing. Okay, this has been several sessions, not very many, and we've gotten profound changes. So we're going to go here. I'm going to do this treatment. We'll come back. We'll treat the spinal cord and see what kind of a change we've made. Jason, let's work on this leg and see what we can do to get it easier to move. Is that a good deal? What do you think of that for a choice?
So you're doing the psoas?
Yes or no, Jay?
Yeah.
yes.
That's good.
So we're going to come over the hip. I'm shooting right through his clothes.
If you want to stand up, you
Oh,
want to get in my
good.
way. I've seen
He's watched me work with him a lot. So. Now look at the ankle. Did you see the scissor? Okay. Give me a little light pen, please.
Like, yeah. Brought it with me. You got it.
Okay, watch. This was the
No,
first
I write your name
thing.
on that pen.
This is the first time somebody hang on to that. Watch it.
I sure still have mine.
Let me show you with this light pen what happened the first time that I treated laser Jason with some acupuncture points. Now, mind you, I had used the laser a number of times, okay? But this time that I used it, I came down and I got real specific, and this is all that I did, except I needed to get to the kidney point here, K3, and he was so spastic that I couldn't even begin to reach that point. So I was doing this, and I said, Jason, I need you to, and that's what happened.
And you asked for it.
No, I didn't. I hit the nerve and I released it with the laser.
Oh, wow.
I couldn't have moved that leg.
Oh,
Did you see it?
Yeah, of course I saw
Did you
it.
see that?
I thought you were just asking for it.
Of course I was asking for it. There's no way you could have done it, but
Okay,
I still asked.
Can you do that again, Heather?
Well,
Dr. Heather?
I don't know if he'll go into spasm because we released it now. But look, here's what happened, okay? He had no voluntary control over that. And even so, we still ask Jason, we expect it. right? Mom and Dad,
Absolutely.
we all expect it. So we talk to him as though he's able to do it. We have that as an expectation. And of course we try real hard all the time. And Jason tries hard too. He
Very
works very hard. But watch, all right? Now, I can force that, and that's a lot of
work.
and okay, but it's better because I just did treat him. But look, now he's rotated and all that's going on. So look, started here, got that point. Started here, got that point, came up, acupuncture point behind there. And then I came down, and my problem was he was so spastic. I actually have to force him into that position to demonstrate it. This was so spastic, you can't imagine. And so I couldn't rotate the foot, I couldn't get it, and I said, Jason, I need you to move, and I grabbed him here, and I said, I need you to move that, and because I wanted to get this acupuncture point, and when I did that, look how straight his ankle came. And it's still continuing to release.
It, yeah.
Okay? Now, your anatomical charts will show you the nerve that I hit. Cutaneous aspect of the sural nerve here. With the laser, gave me immediate response. Then, this toe was locked up. And what I found is a profound association between the great toe and the sutures in the brain. And we got all these toes moving, that toe is just tremendous. But look, that's a movable joint. I can
Yeah.
adjust him now.
Yeah.
I couldn't do anything for years to reduce that. And I immediately took that opportunity and we readjusted that. I thought they were all fused. Everybody thought they were fused. All right?
Oh, yeah.
And so now what we do is we stretch and we bring it down. Okay. Now my next concern in doing his therapy is, can I hit him and clear this Achilles tendon? Remember, I showed you the depth of the Achilles tendon. It's not very thick, but it has profound impact on the brain in the upper cervical area, and we know that's something we want to. And this is all about balance, the Achilles tendon. So when we get the Achilles tendon stimulated, here, thank you, Jason. Watch what happened with his leg there. The tone in his hip changed, so it's not rotated as internally as much as it was. Now, is that about me hitting the Achilles tendon, or is the accumulative now that the laser energy is starting to cook and making it easier?
Sure.
Couldn't tell you, don't care, I just want to move on. But it's a question that clinically someday maybe somebody would care to research. Okay, we're going to come here, we're going to do spleen point. We're going to go and do, here we go, laser point, and there's more dorsiflexion when I hit the liver meridian. Okay. All right, so we're doing good with that. Jason, thank you. Jason, let me have the Q1000 one more time. What I want to do now, all I'm doing now is I want to get as much photon energy into him as I can. And so I'm going to just enter it through the kidney 1 here. And then we're going to just treat all the muscles and we're going to see about movement. What do you think? How you doing, Jason?
Look how relaxed he is, Heather.
He's doing great. Jason, you're doing great, you know.
I think you need this big group
More
all the
muscles
time.
here. I'm sorry.
I said, I think you need this big group
Oh,
here all the
yeah.
time. He's really relaxed too.
No, he's doing good.
Well, basically, he's a ham.
Yeah, I know. He's kind of quiet, a little intimidated to have as big an audience as he does. Okay, Jason. I'm going to ask you, we want to lift this leg 10 times, okay? Did you see no clonus there? Hello.
Okay.
Thank you, Jason.
1,
That's good, honey. That's good. Want to try again?
2.
All right, I'll take my hand off and I'll let you do it all. Let's not count, folks. All right, a little problem here. See that? Getting some scissoring. Jason, put your head down. Now relax. All I want you to do is move this leg. I don't want you to lift your head. And lift this.
No, no head.
Lift this leg. See if you can do it without raising your head. Thank you. Getting a little bit of scissoring. Try one more time so we can focus on this. Okay? Try lifting your leg. Can we do it? No? Okay. Let's bring it back down. All right, Jason, this is what I need you to do. Remember we talked about walking? What did we say about walking? No, wait. Just wait. We're not gonna worry about counting movement now. What did I say about walking? When you walk, you wanna raise this, what? The toe? So you can take a step, remember? Can you lift your toe for me? Raise your toe. Bring your toe up. You gotta bring your toe up because you're gonna take a step. Bring your foot back down and push. Got it? Try lifting your leg one more time. One more time. Keep going, you're almost there. Let's go. Let's go.
Yeah.
I didn't do that. That was not me. I didn't intentionally send energy or anything. I'm just giving him an idea where his toe is. Raise your toe again for me. I want your big toe. You gotta lift that big toe up. Lift your big toe up. Raise your big toe one more time. There's a release there. Try that one more time, dear. Raise your toe. Oh, come on. Come on. Alright, he's lifting the leg. Let's go to the spinal column now. Alright, we're going to have to turn you over for a minute, and we're going to do something we haven't had a chance to do before, okay? Jason, if you bring this arm back, it'll be more comfortable, okay, honey?
He also has tremendous neck muscles.
Yeah, he's got a lot of tone. Do you think we can put his face down?
Right?
Jason?
Well, Jason, great.
And that wasn't possible before?
What he just did was voluntary. He listens and his cognitive affect is going, whoop! You see it? He's participating. He's here with us. Right, Jay? You here with us? Listen, is this up high? Let me put this down a little bit for you. Is that better? Yes? Thank you, Jason. You got the scissoring. Do you see it? Here's our scissoring. Okay. What we're going to do is palpate his feet. You'll see they're a little cold, not too bad. Circulation's not bad. We had a problem with that once.
Oh, for quite a while.
Yeah. Okay. So, Jason, we're going to start, and we're going to start right here. Because you itched that area. Remember when you scratched that? So we're going to go there. And it's your greater occipital nerve. We got access to that. That'll give us information to the brain.
And then look at his wrist.
What's his wrist doing?
It's straight. It is straight.
Oh,
See it?
wow, that's wonderful.
But I'm not holding it.
Right, that's wonderful. Jason, can you open your hand for me, dear? You want to try opening your hand? No? That's all right. Just relax. We won't make you work now. We won't do that. We're just going to do the work for you for a minute. I'm going to raise this up so neither one of us are bending so much, okay? You're doing good, Jason. Thank you. Oh, good. Watch. What are we getting here? Look. What did I just hit? See, 3, 4, and 5. We have a hypoxic patient, brain injury. Diaphragm improves that. Guess what it's going to do for the spasticity if you improve circulation? Decrease the tone. See 3, 4, and 5. Yeah, oxygen decreases the tone. Okay. How you feeling, Jason? Cold? I'm sorry. How's your other arm? He's moving his fingers. Moving his fingers, okay. Alright, Jason, I'm going to come down here. I did not go anywhere near the baclofen pump, okay? That other unit that we have has magnetic properties. Okay? Alright, just a minute. Relax, I'm almost done. So we didn't go near the baclofen pump. So we're going to come down here to the sacrum. Just relax your legs, dear. Don't touch it. Just relax your legs. See the difference in tone? I can separate these legs now. Can you straighten your ankle for me? Alright. Palpate that Achilles, everybody. Very quickly. No. That's it. Look, here, this one. See it, how tight it is? That's what I mean by palpate the Achilles. See how tight now? Look, see it? It's very tight. Very, very tight.
You need help with that?
Yeah, it's gonna pull it back. Well, what's the significance of the Achilles tightness? Postural tone. We expect Jason to stand. We gotta fix that. And Jason expects to stand, right, Jason? One of his big things is Jason's gonna walk again, right, Jason? Right? Right. How you feeling? Relaxed? Piriformis. Remember what we did the other night?
Cold.
You're cold. Yeah.
Oh.
Okay. I know it's a long time to lay like that. Okay, remember? We put this here to feel the tone. And then feel the change if my hand sinks in and we've made the shift that we want. There's not enough shift there. Let's go here. There it goes. That released. Let's go here. Feel it on the other side. See if we can get a change there with the insertions here to the sartorius one. Alright, the muscle tone there is good. Let's go to the back again with the gastrocnemius. Jason, I would like for your ankle to relax in just a minute here, okay? So I'm gonna fix your ankle. Does that sound good?
That was a yes, Heather.
Okay, good, because I can't see. You have to speak loud because I'm not up there, I'm down here. Yes?
Real loud. Real loud.
Yeah.
Okay, good. So it's starting to relax. Can you feel that? Tell me when you can feel it, Jason.
Yeah.
Okay, good. Yes, you can feel it. What do you feel? Is it warm? Is it warm?
Yeah.
It's warm? Now, come on, I'm not putting words into your mouth, am I? Is it warmer?
Jason,
Oh.
Don't make an effort. You just relax. Let's see if we can make a change here. Gotta hold on a little bit longer. We're gonna come up a little higher. Jason, I want to bend this foot. Please relax there.
Yeah.
yeah, I want you to hold his hand.
What's the matter, sweetie? What do you need to
Gotta
do,
watch the
Jason?
camera.
What's distracting him?
He doesn't tolerate being on
I
this
know, that's why we don't.
tummy.
That's why we haven't put him in a position to treat him, guys. I know I'm a chiropractor, I should address the spine, but guess what? This is hard to do for Jason. So, here we go. Whee! Nice change. Nice change, Jason. Alright, we're almost done. Spongy. Come and palpate it. You can, this one's still tight. Feel it? From this one across it. Okay, that one's still tight. Jason, you did great. You done? Let's turn back over.
Anybody else need to?
Anybody want to feel that? Feel the difference in tone? We still have a lot. Well, this is already reduced. Since
This
I
is a
first
rocky
checked
floor.
it.
Oh, man.
Since I first, they say you gotta let the laser work a little bit. Because, you know, it'll mislead you. Think, oh, I haven't done a thing. You come back later, woo! It's still cooking. He's percolating.
Jimmy,
Any questions?
you can turn him.
Take them that way.
Jason, put your,
40 arm, Jake.
Suggestions on areas to use the laser with.
Yeah. So I come up the stairs, give some stuff inside here.
Right here, let's palpate the cross crawl and see then if we can eliminate those neurolymphatic or neurological reflexes. Somebody come and muscle test it. Really close, so therapy localized for me. Alright, legs. And the arm. So just like this arm. Hello. That's what shows with it. So let's just try and see if coming up and treating those points will give us anything extra for today's session, because this is a lot. Anyway, if you separate those legs, I'll bet they'll stay separated. You want to try that, Doctor? Move the knee too. There you go. Can we keep them separate? You want to keep them right there? Nice job, Jason.
the eyes are quieter too.
His eyes?
Are quieter.
I had no nystagmus.
There's no,
Nystagmus. That's a fancy word for it, because he would have a lot of movement. Put your head down. Nystagmus.
damage too.
Yeah.
Damage.
But look, when he moves, he's got ocular motor tone. Cranial nerves, 3, 7, 9, 10. Ocular motor tone. Parasympathetic shift. That's what we've done. So we've seen him controlling his eyes, the facial nerve. Jason, can you smile? You want to tell me that joke again? Huh? Do you hear the voice being a little stronger?
More BSP.
Oh, now that's a good strong voice. Vagus nerve. Yeah, the vagus nerve. No, we didn't check his mouth and everything for that hypoglossal impact, but look at just by... Now, you think that his heart rate variability study is going to show a shift?
Absolutely.
Oh, yeah.
Absolutely.
Okay.
Do you think anybody would outside this room would believe what you just saw? And this is just phenomenal.
There's nothing wrong with your nose. It
Yeah,
just
it's
itches.
itching. But you know, give me a little guy here. Jason, close your eyes for me. He's showing me some place to stimulate. Where is he going to? Here.
Inside here.
Okay. Oh, are you gonna say ah? Say ah. Oh, you gonna look? You can do it for us. Oh, Jason, that was good.
What is that?
Give me a good
Put it on me.
Yeah, you can choose which mode you want.
It's not a deviation, it's bilateral, yeah,
Hit it 2 times to choose
bilateral
it.
drop of the soft tissue.
I keep this hand out of mischief, that's what this is all
Yeah, we're
about.
keeping you out on mischief.
Because one hand can
You
do
wanna see the
more
drawing?
mischief.
Excuse me.
Jason,
Jason, say
Yeah.
ah and sing for us.
real loud.
Can you say ah?
We don't need
Oh,
to sing.
no, I didn't mean it that way. Say ah.
Say ah.
See the drum? Okay. But there's no deviation with the atlas, the uvula rather. That's very interesting. Okay, Jason, now I haven't done any sutures. So let's just do some sutures. All right, let's therapy localize if there's sutures involved. So if we have somebody muscle test for Jim, you want to join me? Thank you.
Thank you.
Now, what did he stimulate? Large intestine point. Did you catch it?
Yeah.
Put your hand down when we know that you did that. Just a second. Okay. Mastoid process, and he's got the shunt right in front of it. Mastoid process, so we know we've got the jugular
Okay.
foramen there, right? Mastoid process. I'm looking for the sutures here.
Jason,
Let's go for it.
today would be bowel program day.
Oh, okay. Oh, I'll help with that. This will make a big difference. It'll make it easier.
Yeah,
And
before
that's
we
what's
get home.
showing up is a mastoid.
Wait till we get home.
We will.
Okay.
Thank you. And this is, yes, that's the red wave work. Okay, Jay. And you can turn your head to your mom for a minute.
Look at me.
Okay, you need to be right around there.
Here.
Hold mom's
There you
hand.
go.
Hold mom's hand. There you
There
go.
you go. Perfect.
Can you put your head? There you go.
There.
And
Oh, that's a
mine-
good turn.
That's excellent.
Whole tone of his neck has changed. Anything else
Put
you
your head in my
see?
hand.
Put some right through here.
And while I'm here, hang on, Jay.
Good job, sweetie.
What'd you see? Got anything?
And just
Yeah.
take a deeper breath.
Yeah, yeah.
Good.
His hips just relaxed all the time.
And because I'm here,
Yeah.
I'm just gonna go for all the organs because we're doing bowel program today, so make it easier and effective. So we don't want them being toxic. Let's go to the other side. Excuse me. Jason, I'm gonna need you to turn your head here. Let's bring this up a little. Switch sides for me.
Switch.
Can you turn your head? How far can you turn your head?
Put your head in my hand. Can you?
Show me how far you can turn your head.
Put your head in my hand.
All the way. Show me.
How's that, Heather?
Let's breath. I just want to see what kind of resistance. Now watch, because it might get easier. That's what I'm going to go for. Oh, take your hand away. Remember, if you put a hand under the occiput, you can be doing a cranial move. All right, so you got to be careful how you do this. I'm sorry, I'm gonna do what's instinctive for me, so I wanna get down here and fix this SCM. And do a real specific K27, follow it up, and then we'll come to the suture. Jason's head is in the nose hole, so. And Jason, it's easier to look at your mom now, isn't it? Turn your head all the way. Can you do that? And we have the shunt there, so we have.
Oh, you noticed. What did I do? I did that to you.
Can you stick your tongue all the way out? Alright, nice. No fasciculation.
Big breath.
No fasciculation. We had fasciculation earlier. Did you see the change? So we impacted the cranial nerve, hypoglossal. When I did that, and I very briefly irradiated here, it didn't take a whole lot. Jason, can you tell me that joke again?
What?
Do you hear the change in voice?
What makes you
Say it again. You're cold. What were you saying about the where do bees pee?
What was the other word you used just now?
peace?
BP station. Can you hear it?
Why?
There was a long line. Can you understand it better? Okay. And what happened with the line?
Full concentration, yeah, sausage.
He
Wait.
flew across to the Esso station.
What you doing with your arm, Jason?
Yeah.
Are you giving yourself a hug?
Yeah.
Alright.
Do you like yourself?
Almost.
Good.
Does it feel good to move that shoulder?
Mm-hmm.
How far are you going to move that shoulder? You want to open your hand and scratch back of your shoulder? That's one hand. Let's do the other hand. Open your hand here, but you got to open your fingers to scratch. So you open your fingers and scratch. That's nice. Now scratch your shoulder for me. He's never done that before. Now scratch your shoulders. Tap with this hand too. Yeah? Feel my... Yeah, that's good. No myoclonus even when he taps himself. So, tremendous change with that. Thank you so much, Jason. Thank you. That was a lot of hard work. Do you feel better? That's your mom. Put your hand down. I'm going to ask you one more time to move your leg down here. Can you move this leg for me? Would you raise your leg for me, please? Can you try that? Somebody take this for me. Okay. Oops, thank you. Okay, put your head down and do it this time. Try moving this leg. Raise your leg up. Oh, we got a problem. Yeah. Oh, nice job, Jay. Let's do this without getting hooked. Try moving your leg again. Nice job. Nice job. Put your leg straight, dear.
Jason, inappropriate.
Put your leg straight, dear. You want to join me in paralysis studies, guys? For rehabilitation with stroke and TBIs? Come on.
Can you get it up there, Jay?
Yeah, nice. You did that. I didn't do that.